Hi, I'm Diana Alexander, and I'm here with you again for another San Bernardino County COVID-19 news update. I have some papers in my hand that are hot off the presses, and I say that because we just received a new order of the health officer of the County of San Bernardino for the control of COVID-19. This order will go into effect tonight after you all are fast asleep at midnight. And it basically tells us some more information about a lot of the things that we have been talking about all along. But I think it's going to clarify some things for us. So we have someone with us today to help with that clarification. And it is our own County Board of Supervisors and 4th District Supervisor, Chairman Curt Hagman. Welcome.
Hi, Dana. Thank you for having me on again.
Yeah, we're glad to have you. So I'm just getting a chance to look at this, but you got an opportunity to read it a few minutes ago. So I just wanted to ask you some questions about it, but could you first tell us why do we have this new order?
Yes, and for the general public, there's multiple different directions or orders coming from both federal government, state government, and what our own county public health officer is issuing for the county of San Bernardino. So this document is an attempt to bring all those orders into one clear and concise document that people can read and understand what that means that they're doing. So as we get these changes from the state or the federal government or our own public health officer, we have to issue new orders and get them out. So this is the new rules of the land as of tonight at midnight.
Okay. Well, in the order, it starts off with one of the real hot topic items, and that's essential businesses. What is it telling us now about essential businesses?
Well, we are all familiar with the stores being open, the gas stations being open, the mechanics and different things we go to right now. Those are from directives from the federal government to the state government down to us, which stores, which services are going to be available to us. What this does is combine those stores and services with the county public health officer of what things we need to do if you're going there and if you're working at one of these essential businesses. So it requires us all to wear masks, both the worker and the patron to go in to wear a mask and to wear it properly over their nose. Mm-hmm. Describes it wearing over their nose. Too many people are wearing around here like this. It requires physical distancing. I believe it's 6 feet to make sure we maintain that physical distance whenever possible. And those type of things to clarify that even if you're essential business, you still need to do these type of things that the general public, that you and I have to do when we go outside of our house and wear our mask and keep our distance.
So does this mean that if I go to a business and I don't have on a mask, that they can refuse service to me?
Absolutely. One of the orders in there is that any business can refuse service to anyone not wearing a facial covering. It doesn't have to look like my mask. They have a whole section on what a mask is in there, and it's facial covering. That's the nose, it's the mouth, it could be a bandana, it could be other different things. You don't have to buy a surgical mask, but it has to be covered your nose and your mouth before. And the manager of the business or one of the employees will say, no, you can't come in without that mask.
Okay, thank you very much.
In fact, they should be saying that because that's an order from the county right now that no one's supposed to be out there without a mask.
Good, good. Thank you, sir. The next big topic is public or private gatherings. And it seems to be defining what a gathering is and then giving some talk about what it is that we're supposed to do or not supposed to do as far as numbers of people and things like that.
Sure, and it's really combining that physical distance with your party. Your party consists of your family. It's not going to be you and your neighbors, you and your friends. Group gatherings is more than one person. It's 2 people or more that are not part of your home family people that get together within that 7 feet. So there's a lot of common sense at the same time hard to put in order. So if I have a green grass park in front of me, I can have several different people in that green grass, but they have to maintain their 7 feet. And government, local government, county government is supposed to be able to regulate the usage of that public space by maintaining at least 7 foot distance. And some cities are shutting down their public parks completely and their open areas and by regulating the number of parking spots available, whatever. But the whole idea is to keep our physical distance from our core group. My family next to your family, we got to keep this physical distance apart. And so there's a lot of details in there how it could work. It does not order all public places necessarily shut down, but if we go out on a walk, it talks about if you're solitary exercise outside, if you have to wear a mask, but really more importantly is whatever we do, we have to maintain that physical distance. Now, does that mean that 10 of us can't go listen to someone talk if we're spending 7 feet away? Yes, we have to wear a mask. They are 7 feet away. We could talk to someone, or we could talk to our neighbors across the street, keeping our physical distance and wearing our mask. So it's not trying to be antisocial, but just that practicality of keeping that spacing, at least that 6 feet apart, and wearing our mask when we go outdoors.
Okay, so Chairman, I know we've been teasing you a little bit because you're determined that that social distancing has to be 7 feet. But does the order say 7? Does it say 6? Because you know people are going to ask.
6. I'm sorry. I don't know why I like the number 7. It must be lucky or something like that. 6 feet is what the order says. 6 feet is the order, and I like to even go, it says social distancing, I like physical distance, because I think we can all be very social at 6 feet away, and not necessarily say, well, we can't see or talk to anybody. Yeah, we can, just keep that 6 feet away, but 6 is the correct number.
Thank you. And I noticed in the order, too, it says that that distancing does not apply to homeless encampments or gatherings required for essential businesses referenced in the sections in the order.
We try to make sure we keep that 6 feet apart, but in some areas, you're not going to have that. If I have the patient and a member in the ambulance going together, they're going to be close together. If I have a small kitchen that's doing the fast food, whatever, and they have no physical way to do it, we want them to be covered and do it. This is a pragmatic method for us to try to stress that 6 feet really is for our benefit. It protects us and protects the people we're interacting with, but in some cases for those essential businesses, it's physically not able to. So we use all the other precautions we need to make sure that we try to keep as much distance as we can and to wear our face coverings and make sure we do our hygiene.
Thank you. Thank you for clarifying that. The other big topic that's in the order references public recreational activities, the parks, the trails, the beaches, etc. What does it have to say about that?
Yeah, I kind of got into that last question too a little bit, is that some jurisdictions are going to say, I can't monitor and keep people, they're 6 feet apart, their physical distancing, so I'm going to shut them down, which they're allowed to do. Others are going to leave them open, but what the order requires is that if these public spaces are being used, that people stay at least 6 feet apart. So that's what the order is. Now, it doesn't mean you're 6 feet apart away from your kid and your husband or your wife or whatever the case it is. We as a family can be together, but your kid can't go play with the neighbor's kid, okay? And you can't cross-populate those areas, so that 6 feet away. And local government, the county is empowered to figure that out in their public spaces any way they want to do that.
Okay, thank you very much. And here's the other great topic that you've talked about before, and that's face coverings. Is there anything different, anything new?
I would just say this, out of all the things we're asking for, the face coverings is going to be here to stay for at least the foreseeable future. Whatever freedoms we get back as this thing progresses, it's going to be based upon us maintaining our distance and wearing face coverings. So the face coverings is very important. It directs how it can be worn. It directs what is considered a face covering. It directs, you have to have your nose covered and not just your lips, and how. But the more we're able to do that, this is probably the best thing we could do to keep ourselves safe from COVID-19, this face mask. If we don't get, even if we accidentally get too close to someone or one of those critical infrastructures that may run into it, this will protect us. So we have to get used to this as a society right now for the near future and probably longer. So wear your facial covering when you go outdoors. Well, the order basically says when you go outdoors, you have to have a facial covering. Doesn't mean if you're working out, you can't pull it down and go work out. And if you're walking your dog, but when you get close within, you're going to cross someone, you got to put it on. And that way, because you're going to encounter someone when you're jogging on that trail or something like that, you have to have it with you.
Now, for face masks, though, it's still okay if I'm driving in the car with my family for us not to have them on in my car.
Yes, it goes into more specificity on that because the first one we put out was a little broader. You just have to have them with you. So when you're driving a car, you don't have to drive like this. You can have it off. If your family in your car, you're okay. If you bring your neighbor in the car, you're giving your neighbor a ride to the doctor, yes, you have to put it on. Again, so it's common sense. If you're with your core group, you don't need to wear them in your car. But if you go through a drive-through and you roll down your window and you order your Starbucks coffee, you must have it on when you roll down your window. Mm-hmm. So if you break that 6 feet closer to anybody else, you have to have your mask on.
Okay, thank you for clarifying that. Also, it talks about lodging and short-term rentals. What are some of the rulings in the order referencing those?
Basically, they're not open. They're not open except for certain circumstances. Mm-hmm. Where they're housing homeless, we're here to, if we need to isolate someone because they have COVID-19, they're here for critical infrastructure personnel to be able to stage if we need to put them in certain places. But for the most part, they're not open right now.
Okay, thank you. And I don't think there's been really any changes relative to persons who are exhibiting symptoms. What are we telling folks if they're exhibiting symptoms?
The same thing as always. If you feel sick, if you have a fever, if you have coughing, some of those symptoms that we have, we ask you to stay home and isolate yourself. And we have a lot more information on the website, which this will be on. We have our Joint Information Center hotline. You can always call 387-3911 to get more information. But if you feel ill, the best way we can stop this for the county is to take care of yourself at home in isolation and don't get other people sick.
Okay. Thank you very much. And that pretty much still applies to high-risk category individuals, those who are vulnerable.
We're saying that for those who are in the vulnerable population, and we talked about 65 years older, we talked about those in poor health, I'm not still thinking 65, that we stay at home. The stay-at-home order is still in effect for everyone right now. Stay at home unless you're doing essentials, going to get food or you have to do something. But this will be over soon if we all rally together and do the proper things that we're asking everyone to do.
Sounds great. So in closing, because we've hit the high points in the order, is there anything that we might not have said that you want to say or any encouragement you want to give to our residents?
We're doing a great job. I see a lot more compliant folks out with their face masks. We need everyone to be wearing some kind of facial coverings when I see you outside. The sooner we can rally to do these physical distance, wearing a face mask, washing our hands, the sooner we can get back to adding more freedoms to ourselves. The longer we don't do this, the longer the numbers will still reflect it in our daily counts of COVID testing or hospitalization rate and all the rest of it. We have to hit certain benchmarks for us to go back to more freedom. So this is for our own good. This is to keep ourselves safe and to our mental health get us back to normal. So please wear your face mask. Please get something with you at all times when you're outdoors. Please keep your physical distance 6 feet. And please wash all the time. And we'll get through this together very quickly. You're doing a great job. We can do a little better. We're talking hopefully weeks we can start adding. So these things may change. This order may change next week. And we are adapting and doing as much as we can, as quickly as we can. And we all want the same goal. We want to get back to our life. We want to be able to go back to eat, sit down restaurants and go back out shopping and be with our friends and stuff. And there's going to be ways we could do that if we get some of these basic habits down.
Thank you so much, Chairman Hagman, for taking us through the latest order from our Department of Public Health. We really appreciate you breaking that down for us. And we appreciate what you said. The more we commit to these measures, the sooner we will gain our freedoms back. So again, this has been San Bernardino County COVID-19 News Update. We thank you and we ask you to please stay safe and take care.